How best are you going to look after the nurses?
In a meeting with the Health Minister Jelta Wong this morning, all issues and grievances were raised. Their issues include no PPEs for frontline officers, no training and allowances for nurses responding to COVID-19 patients, and standard operating procedures at Port Moresby General Hospital and other health facilities have not been implemented.
Currently for NCD health facilities, as I am the president, I already inspect all the areas. Standards for COVID-19, which has been outlined, has never been implemented as of 2nd of June till now.
And that strong recommendation is in a form of written form, which we want to see it implemented. The Port Moresby General Hospital management has failed us big time in their leadership and governance in managing COVID-19.
Earlier this year, a similar meeting was held with the Health Minister where issues concerning PPEs and allowance were raised by the nurses. However, not much has been done to address their issues. They claim their issues have not been addressed due to poor management and leadership at the Health Department. In their petition this morning, they called for a change in management at the Health Department, starting with the Health Secretary.
We want change in leadership, change in governance to ensure that whatever little resource that we have must be maximized to ensure that quality health services are delivered to the population of this nation who rightly deserve a quality health care.
Nursing officers from rural health facilities around the country also raised concerns on PPEs, poor health facilities and manpower. They say under this health SOE, more attention must be given to the health sector and funding must be made available to improve health facilities. While these issues are yet to be addressed, some nurses and their families have been facing discrimination from the public and some have been reported sick.
So much funding has been pouring into to fight COVID, but it is not going down to the health service facilities and health service delivery, and that is surely something is wrong. You can see that Port Moresby General Hospital, who was standing in for the whole nation throughout the country, for all the workers and for the health service throughout the country, they are now telling the government that there is seriously something is wrong.
The Health Minister, when receiving their petition, assured the nurses that the government is working on a package for nurses. He further advised nurses without PPEs to stay away from work until they are made available for them.
If you are working at POM General Hospital now and you do not have PPE gear, please don't go into work. I will go now and make sure that there's PPE gear at POM Gen, and when it's there, I expect to see everybody there. I'll do things for you, but you will do things for the country.
The Health Minister adding that he is committed to helping nurses who are the frontline workers in this health crisis. Their petition will be presented to the National Executive Council.
I will take this petition to the Prime Minister. I will bring the Acting Secretary. I will bring the CEO for POM General Hospital. We'll sit down together. We'll invite the Secretary or the President of the Nursing Association. We'll all sit together and we'll come up with a plan to mitigate and make sure that we look after all our nurses.
Rayon Lakingu National, EMTV News.